What it feels like having a vitamin B12 deficiency. A chemical called vitamin B12 aids in the production of DNA, the genetic material found in all of your cells, as well as maintaining the health of your body's blood and nerve cells. Megaloblastic anemia, a blood disorder that causes fatigue and weakness, is another ailment that vitamin B12 helps to prevent. Weak muscles, numbness, difficulty walking, nausea, weight loss, irritability, weariness, and an elevated heart rate are all signs of insufficient vitamin B12. Supplemental vitamin B12 may be used in treatment. A vital nutrient is vitamin B12. Vitamin B12 can be found in abundance in apples, bananas, blueberries, oranges, fish, shellfish, meat, eggs, and dairy products. The recommended dietary allowance is the quantity that should be ingested each day, RDA. For individuals 18 years of age and older, the RDA is 2.4 micrograms per day. Here are vitamin B12 health advantages that are supported by science. 1. Promotes the production of red blood cells and prevents anemia. Red blood cell production in your body is greatly aided by vitamin B12. Red blood cell production is reduced and cannot properly develop when vitamin B12 levels are low. When vitamin B12 is deficient, red blood cells, which are normally tiny and rounded, grow to be larger and often oval. Megaloblastic anemia is brought on by the red blood cells' bigger and atypical shape, which prevents them from entering the bloodstream from the bone marrow at the proper rate. Your body doesn't produce enough red blood cells to carry oxygen to your important organs when you have anemia. Weakness and weariness are possible consequences of this. 2. Could avert severe birth abnormalities. For a pregnancy to be healthy, vitamin B12 levels must be adequate. According to studies, a fetus's brain and nervous system need enough B12 from the mother to develop normally. Early in a pregnancy, vitamin B12 deficiency can raise the chance of birth abnormalities such as neural tube disorders. Additionally, a mother's lack of vitamin B12 may result in a miscarriage or early birth. In an earlier study, it was discovered that women with vitamin B12 levels below 250 mg per deciliter were 3 times more likely to give birth to a child with birth abnormalities than women with appropriate levels. 3. Could promote bone health and shield against osteoporosis. Keeping your vitamin B12 levels stable may benefit the health of your bones. Low vitamin B12 levels have been associated with men's femur and hip bone mineral densities in one study of 110 celiac disease patients. Over time, bones with low mineral density can deteriorate, increasing the risk of osteoporosis. A connection between low vitamin B12 levels and poor bone health, osteoporosis risk, or fracture risk has also been demonstrated by other studies. More research is required because other studies on the impact of vitamin B12 on bone health have produced conflicting findings. 4. Could lower your risk of developing macular degeneration. Your central vision is primarily affected by the eye condition macular degeneration. Age-related macular degeneration may be reduced by ensuring adequate vitamin B12 levels. Homocysteine is a sort of amino acid that is prevalent in your circulation, and researchers think that taking vitamin B12 supplements may lower your blood levels of it. Age-related macular degeneration has been linked to higher homocysteine levels in the blood. A 2009 investigation involving 5,000 females aged 40 or older found that vitamin B12, folic acid, and vitamin B6 supplements may lessen this risk. 5. May enhance mood and depressive symptoms. Your mood might be enhanced by vitamin B12. There is still much to learn about how vitamin B12 affects mood. The neurotransmitter serotonin, which controls mood, is synthesized and metabolized with the help of this vitamin. So, a vitamin B12 deficiency may result in less serotonin being produced, which might result in depression. In an older trial, patients with depression who also had vitamin B12 levels that were below normal were treated with both antidepressants and vitamin B12 and were more likely to experience reduced depressive symptoms than those who only got antidepressants. 6. may strengthen cardiovascular health by lowering homocysteine. The amino acid homocysteine has been associated with a higher risk of heart disease. Your homocysteine levels rise if you have a severe vitamin B12 deficiency. According to studies, vitamin B12 helps lower homocysteine levels, which may lower your chance of developing heart disease. However, there isn't any current scientific proof that taking vitamin B12 supplements can actually lower your risk of developing heart disease. Therefore, more investigation is required to determine how vitamin B12 affects heart health. 7. Encourages strong, healthy skin, hair, and nails. A sufficient supply of vitamin B12 is required to support strong hair, skin, and nails because this vitamin is essential for cell development. In actuality, low vitamin B12 levels can result in a number of dermatological symptoms, including as angular stomatitis, vitiligo, the loss of skin color in areas, hyperpigmentation, and nail and hair abnormalities, inflamed and cracked mouth corners. When vitamin B12 insufficiency is treated with supplements, dermatologic symptoms have been proven to improve. It's uncertain whether taking a supplement will have any effect on your skin, nail strength, or hair health.